So it's time to move on to the penultimate session of the day. This is going to be about emerging hotspots and diabetes. And to chair the session, we have four chairpersons. May I call upon Dr. A.R. Balamurugan and Dr. C.S. Gauthaman, Dr. T.K.V. Sharavanan, and Dr. T. Jayapakiyam.
So we'll move on to the next session. We'll welcome you all for the next session. We have 5 interesting topics. All these topics were normally not talked about in most of the diabetes forum, and they are always the obscure complication of diabetes. The first topic is more important because it affects one person's self-esteem and causes a lot of psychological issues in a person. It is hair loss in diabetes. To talk on the topic, I now request Dr. Gauri Shankar, the most energetic speaker I've always seen, a good friend of mine. And over to you, Gauri. For the next
Thank you, sir. Respected chairperson, respected Anand Moses sir, Parandaman sir, thanks entire team for giving me an opportunity to talk on this topic. So, another hair loss, diabetes, I did a literary search, so I will present whatever I have learnt. Okay, so the disclaimer is I'm not a dermatologist, so please don't ask me how am I going to treat these conditions. So we will come to the core topic. The average human scalp contains about 1 lakh hair. Unless you have a hair loss of about 50 to 100, we don't call it as a hair loss. That is something which we need to fundamentally know. So what is called as a hair loss? The second point is hair grows at the rate of 1 centimeter per month. This is something, the second point which we need to know. We will reiterate it later. And the hair grows from, remember this mnemonic for the youngsters, ACT. It grows in 3 phases. One is anagen, catagen, telogen. Anagen is the growth phase, catagen is the maintenance phase, telogen is the shedding phase. So ACT, remember these 3 phases, anagen, catagen, telogen. I did some research, some browsing. What research? Browsing. So it showed like early androgenic alopecia as a marker of insulin resistance. This article was published in Lancet in the year as early as 1990. What is this early androgenic alopecia? So if Dhanush comes and if he shows his hair like this, if his scalp, patta, nethi mattum therinjaduna, that is stage 1. அதே இப்படி தூக்கி காட்டினான்னா ஸ்டேஜ் 2. அதே நம்ம அண்ணாத்த விஜய் வந்தார் அப்படின்னா அந்த சொட்டை மட்டும் தெரிஞ்சதுன்னா 3. அதே பெருசாச்சுன்னா 4. இது ரெண்டும் சேர்ந்ததுன்னா 5. அப்புறம் நம்ம தலைவர் மாதிரி இருந்தா 6. இதுவும் போயிடுச்சுன்னா 7. So this is androgenic alopecia like this. But the point that we need to know is androgenic alopecia is very, very specifically in this article as the people who had a higher weight gain, if there is a obesity, they were associated with higher increase in the incidence of androgenic alopecia. That is one thing which was fundamentally shown in this article. The second point which is very drastic is, which is very characteristic is, if people are taking antihypertensive medication, if people are taking anti-diabetic medication, if people are taking anti-lipid medications, so whether it is hypertension, lipid or glucose, the incidence of or the odds ratio of having an androgenic alopecia is higher. And not only that, if the insulin resistance, if various factors associated with insulin resistance are increased, the androgenic alopecia incidence is higher. Also, if the serum insulin level in the body goes about 10, it is again the odds ratio of becoming an androgenic alopecia is higher. So this, as the disease progresses, as this androgenic alopecia comes, what actually happens is the length of the anagen, we said ACT, the length of the anagen is shortened, whereas the hairs in the telogen phase is maintained. So when the anagen phase is shortened, there is a miniaturization. The hair length or the growing phase is shortened. And because of this, the hair loss happens. But most important thing that we need to know is, once it hits, it is very difficult for it to go back. So what do we need to know? So all these comorbidities, our diabetes, insulin resistance, everything has to be controlled if you don't want to land up in that stage. So that is what all that we need to know about androgenic alopecia. There are other articles also to substantiate these findings. Then comes the second hair loss that we need to know. The second thing is something which we characteristically see in our clinical practice. This is the alopecia areata. you have a small patch of hair loss. It can be one or multiple. This comes typically in youngsters. So people less than 20 years are mostly affected because of this alopecia areata. Men and women are equally affected. But what we need to know is this alopecia areata, when the skin biopsy is taken, the periphery of the alopecia areata was showing more amount of lymphocytes, which shows that there might be an autoimmune condition related with this. So when we see a patient with this type of hair loss, always look at whether these conditions are there, and that includes diabetes. See whether the patient is having an insulin resistance. So there are articles to show that this can be a sign of insulin resistance also. That is the second point that we need to know. Then we spoke about male pattern hair loss. Then we spoke about alopecia areata. Then comes the female pattern hair loss. In female pattern hair loss, what happens? When we look at them, women come and say, Mudiya uludung doctor. But if you see, like they all will have fine hair. Ask them to bend and see, they will have everything, it is all gone over here. So the frontal portion will be preserved and it will be going like an inverted triangle in the backwards. So that is what happens in these women, and 50% of the women face it in their lifetime. So how do we need to assess, or how do we need to check whether they have a female pattern hair loss? There is something called as Mudiya pudingi pakanu. So hair pluck or pull test, these two terms are used. So when you try to pull the hair like this, you hold 50 to 60 hairs. See which quadrant it is getting pulled. So if it is going to happen only over here, it means that they have a female pattern hair loss. And when you pull, if you are pulling 60 hairs approximately, if more than 10 hairs comes, it means it is a positive test. So that is what hair pull test shows. But in these women who suffer by this, there will be an associated abnormal menses, there might be an infertility, they may have an hirsutism, unresponsive cystic acne, virilization, and galactorrhea. What are all these things associated? You can relate to hyperandrogenism. When hyperandrogenism comes, these all comes. Where do we see the hyperandrogenism? We see in PCOS. What is PCOS? It is an insulin resistant state. So it is what is all the common link between all these things? It is the insulin resistance which drives this. So please look for insulin resistance even in the female pattern hair loss through the mechanisms that we have said. Then there comes an interesting entity in the current decade, especially after COVID. This is telogen effluent. So what does this shows? Telogen effluent occurs when there is an increased number of hairs that enter into the telogen phase. So from anagen phase, it doesn't go into catagen phase, but it goes into telogen phase. Once the hair goes to telogen phase, there won't be any more growth in the anagen phase, and eventually the hair will fall in 3 months. So if there is a hair fall that they are reporting only in the 3 months, not only in the scalp, it can happen in the body, it can happen in the pubic hair, it can happen elsewhere in the body also. So when such sort of hair loss happens, think about telogen effluent. So what is more important is telogen effluent comes with crash diets. Nowadays this is what we discuss for all our diabetic patients. So when there is a crash diets, or as Gautaman sir was telling, like psychological stress, this is what is happening to all our patients. The AC inhibitors and beta blockers also can cause, as well as the hypothyroid and hyperthyroid also can cause telogen effluent. And the other small points that we need to know about hair and hair loss and diabetes is, hair can be used as a marker to assess the glycation. So how the blood gets glycated to show that the glycation reaction, the HbA1c reaction happens. Similarly, the glycation can happen in the hair also. We said hair grows at the rate of 1 centimeter per month. So the 4 centimeter of hair, if you see, it will roughly correspond to HbA1c. There are studies to validate this point, and if you see 12 centimeter of the hair, it will correspond to 1 year of glycemic control. So tell me one parameter from where we can assess the glycemic control of a patient for 1 year. There is no test at all to do that. So from the hair, we can pick up that point. So even 1 year of glycation can be seen over there. And the moment patients comes with the diabetes and hair loss, what do we say? We put them on lots of vitamins. There might be selenium increased, chromium increased, toxicity of selenium, zinc is decreased. All these things can be assessed in the hair. But what works to our patient is, there are data to show that, yes, vitamin D is associated, but 4 things that we need to remember is, one is iron, folic acid, biotin, B12. So all these things can be helpful in the in rejuvenating the hair loss. Apart from this, all that we give are just placebo, no data. And I would urge, if any of you is interested in reading about this, please read this article, phenomenally written in simple English to show that how much amount of placebo we pump our patients with. And last point is, there are case reports to show that these two drugs, especially linagliptin and teneligliptin, more with the teneligliptin, many number of articles to show that the moment we start them on teneligliptin, there is an increase in the incidence of hair loss. And also we need to remember there are specific instructions about metformin, because metformin will competitively always fight with B12 for the intrinsic factor. That is the reason B12 is getting decreased. Through that mechanism, metformin also through B12 mediated mechanism can cause a hair loss. So this is something which we need to know. And the moment we say somebody has got hair loss, so see the number of drugs. This is for a simple 23-year-old male who came last week to me with this prescription. So this is the prescription for hair loss, not for any big pancreatic surgery or ICU surgery, means ICU admission, nothing. Just for hair loss, he was getting so much amount of treatment. So this is what our some of us may be treating for hair loss. The psychological stress that is associated may warrant all these things. Let us leave about the finer things. So already surgical colleagues, other medical colleagues also might be telling us your glycemic control is the reason for all these things. Long COVID, diabetes. Cough, control your sugar. Your urinary problem not getting over, control your sugar. Your eye problem not getting over, sugar. Fetal outcome, sugar. Now dermatologists are competing with them also. They might be telling if your hair is not growing, control your sugar. It is all with sugars. With this I conclude. Thank you.
Next topic will